Three. I'm a RN, and today we're going to talk about the opioid epidemics. Okay. Today you will learn about the national opioid crisis. I'm explaining the impact of the national opioid crisis on the healthcare industry. I'm gonna do signs and symptoms of opioid abuse that y'all should know about, and I'm gonna identify ways to combat this threat to our health. Okay, so opioids are substances that act on opioid receptors to produce morphine-like effects. Medically, they are usually prescribed for pain. Types of opioids include oxycodone, hydrocodone, morphine, and codone. Okay, so the national opioid crisis. According to the CDC, since 1999-2017, more than 700,000 people have died from drug overdoses. Around 68% of those, more than 70,000 people that have died, involve the opioid type of medication. The American government has spent over $504 billion trying to combat the opioid epidemic. On average, 130 Americans die every day due to opioid overdose. The misuse of and addiction to opioid is a serious national crisis that affects public health as well as social and economic welfare. In the late 1900s, pharmaceutical companies reassured the medical community that patients would not become addicted to opioids and pain relievers. Healthcare providers began to prescribe them at a greater higher demand. It ended up leading to a widespread misuse of these type of medications. It became clear that people were getting addicted to opioids. Okay, let me give y'all some statistics. Roughly 21 to 29% of patients prescribed opioids for chronic pain. Between 8 and 12% develop an opioid use disorder. An estimated 4 to 6% who misuse prescription opioids transitions to heroin. About 80% of people who use heroin first misuse prescription medications first. Opioid overdose in large cities increased by 54% in 16 states from 2016 to 2017. Okay, according to the CDC, the total economic burden of prescription opioid misuse alone in the U.S. is $78.5 billion a year. An estimated 1.7 million people in the United States suffer from substance use disorders related to prescription opioid pain relievers, and 652,000 suffer from a heroin use disorder. The epidemic costs Medicare an estimated $68.4 billion a year to combat this. Okay, so signs and symptoms to teach your peoples or to know when you're dealing with people that have a drug overdose. Look for sleepiness, constipation, nausea. Opioids can cause more serious effects, and these are life-threatening side effects, which are shallow breathing, slowed heart rate, and loss of consciousness. So ways we can combat opioid threat: improving access to treatment and recovery services, promoting use of overdose reversing drugs, strengthen our understanding of the epidemic throughout better public health surveillance, providing support for cutting-edge research on pain and addiction, and advancing better practices for pain management. Making a difference. How I plan to use this information that I researched is by educating my patients that I know have an opioid problem that come in, maybe a positive drug test. I will educate them on the effects that it has on them and what it can do to their babies, since I do directly work with patients in labor and delivery. Also, I will provide resources and support group information. I can recommend other medications to non-pharmacological ways to combat their pain, like guided imagery and things like that. I will educate them and also their family members on signs and symptoms to look for as the patient is opioids, and also we can try to get them some help. And that, ladies and gentlemen, is how we combat the opioid epidemic in our health system. This is my audience of healthcare workers. So this is my audience. These are some nurses.